everybody, I'm Journo Jess. Today I'm here to talk with Nurse Tayler, who actually spoke with me back in August. And now I want to find out how she is continuing to cope with the pandemic. Since the last time I spoke with Nurse Tayler, I have continued to follow her on her social media accounts. Often she speaks about the importance of people wearing their face mask and what she is going through on a daily basis. Today I want to hear more about the struggles she has had to endure and how she is coping. Hi Taylor, how are you doing today?
Hi, I'm good. How are you?
Yeah, so far so good. I know things have been a little rough since the last time we spoke. Can you kind of tell me, what has changed since August, since we talked?
Yeah, unfortunately, things have gotten much worse. I hate to laugh about it, but yeah, the caseload has increased significantly. So we are way busier than we were back in August. Our caseload, I think for the last 5 days, we've beat our record of new cases consistently every day for the last 5 days. And I think last week, Navajo Nation had 900 new cases just that week.
Oh my goodness. I also saw that are you technically on a stay-at-home lockdown order right now?
The reservation is correct. Yeah. I'm staying right off of the reservation in what we call border town. And there's not really any COVID rules here, including like a mask mandate, anything. But the reservation did go back under very strict lockdown. So that's caused a lot of problems in itself. But yeah, that was in response to the insane surge in cases.
Okay, and in terms of the cases, have you noticed that the death toll has went down at all?
No.
No?
It hasn't gone down. Yeah, it has not gone down.
Have they had any type of treatments that new treatments they've been trying out, I guess?
Yeah, and we do know more about the virus. As a nation, we know more about the virus. I'm not really seeing that specifically here. In my personal opinion, in my personal experience, I haven't really seen that much of a difference. And, all the medical knowledge that they've come up with and all these discoveries of these great drugs, it doesn't really mean a lot if the drugs aren't accessible, and it really doesn't mean anything if there's no room in the hospital to treat the patients, which is, what we're running into a lot of lack of resources here. So it only goes so far.
Yeah, and you said before that there's absolutely no beds available for people. Mm-hmm. Is that correct?
I don't know about at this very moment. I know within the last few weeks, there's been multiple days I've come to work. One day I came to work and there were 0 ICU beds in the state. Yesterday I worked. We were trying to transfer a patient out and we couldn't find anywhere to send them. It's just a multiple occurrence for me that we're trying to, call 2 or 3 hospitals to find room for a patient. And so, yeah, hospital beds is definitely a scarce resource these days, which is really scary. Even, it's like I tell people, if the ICU is full because of coronavirus patients and then you get in a car accident, it doesn't matter that you don't have coronavirus, the ICU is still full.
Wow. What do you do in cases like that?
You just things just kind of happen. But honestly, a nurse takes care of more patients than they're supposed to. ICUs go beyond their limits, hospitals go beyond their limits, and that's what's happening. I haven't personally seen this, but I have seen hospitals across the country put out statements that they are soon going to reach their limit and have to start turning patients away, which is really scary. This is America in 2020, and you think about the concept of a hospital turning patients away is just insane. But I do think we're headed towards that point. Just from my personal experience and my personal professional opinion, I think we're headed towards that point.
Oh my goodness. So do you think, are people still not taking the pandemic seriously? Is that the problem?
I don't think that's the problem within the Navajo people. It's not an issue. I'm taking it seriously. A lot of the reasons that it's spreading so uncontrollably here are out of their control. I definitely think the general population is not taking it nearly as seriously as we should be. But, the Navajo, there's no work on the reservation. They have to work off of the reservation. So when the surrounding community isn't taking it seriously, it affects them. And then they go home to their multi-generational households that are home to 9-10 people, including their 92-year-old great-grandma. And there's a lot of factors. I think nearly half of the population lives below the poverty line. So, when I tell someone, you were exposed to coronavirus, I need you to take off for 2 weeks. 2 weeks of missing a paycheck is pretty detrimental to someone living on low wages. So there's a lot of reasons and a lot of factors outside of their control that's contributing to the spread.
Yeah.
And we preach, hand washing. 1 out of 3 households out here don't have running water. So, the spread is inevitable.
Yeah, I remember you telling me the last time I spoke with you, you said, there's generally a lot of people in one household. They definitely don't have running water. So I know that is definitely a factor. So that's probably still obviously the case, really, why the cases are continuing to go up.
Yeah.
So I know the last time we spoke, in terms of resources, maybe PPE or any other things, has that gotten any better?
PPE is fine. I think PPE is that in terms of resources is fine. The biggest issue is resources available to the community. I personally tried to get food for a patient today and was just told, we're out, we don't have any, sorry. So that's an issue.
Wow.
There's just resources available to the patients is pretty scarce now.
What about, I know your main role is track and tracing. Do you have enough testing available?
We have enough testing. That's not the issue. Now we are running into the problem of we have so many cases coming in a day that it's impossible to keep up with contact tracing. At our height over the summer, we had 20-ish cases coming in a day. On Friday, we had, I think, 67 new cases that day. And so we're constantly 40, 50 new cases a day, and it's just impossible to contact trace for that many people. So testing's not the issue, but manpower and contact tracing is a huge issue.
Wow. So do you have a team of people that you generally work with?
Yes, public health nursing is my quote-unquote team. It has expanded greatly because it's kind of an all-hands-on-deck effort now. We have people from nutrition, people from pharmacy, the physical therapist, everyone's contact tracing now, but it's still not, it just doesn't seem to be enough. We kind of always make a joke of we're just the violin players on the Titanic because it's just going down and we're just, just keep playing.